Sorry. Hi, everyone. My name is Simran. As Dai said, I am a research officer and I played a role in the drafting of this guide. So I helped to review the evidence related to the relationship between parental conflict and parents with mental health difficulties. And some of you may recognize me from the focus groups I held to learn how to best engage parents with mental health difficulties in relationship support and the learnings of that, which was drafted in the guide. So I'm really looking forward to discussing more with you all today. I'll pass over to Steph to introduce herself.
Hi everyone, I'm Steph Fletcher. I'm also a research officer at What Works for Early Intervention and Children's Social Care, which is a mouthful. I didn't work on this guide specifically, but I've been working on reducing parental conflict and on another guide, and I'm very familiar with this work, and I'm looking forward to talking to you all about it. I'll pass over to Bethan.
Hello everyone, lovely to see you all today. So my name is Bethan. I am a Senior Local Development Advisor at, do you know, I won't say the name again. And I am in charge of managing the chat questions today. Please do engage via the chat. I'll do my best to respond during the webinar. If I don't get to you, we'll do our best to respond afterwards. But we will have a section at the end for questions. So if we don't come to questions immediately, and if I can't answer them in the chat, we will come to those at the end. But thank you for joining us this morning.
Great, thanks, Bethan. Jude, would you like to introduce yourself?
Hello everyone, it's nice to see some familiar faces like Di mentioned before. I definitely have already met some of you before, but my name's Jude Gordon. I am the National Programme Lead at Relate around reducing parental conflict, and I'm just here today to talk a little bit from a practice perspective following the phase 1 of the Reducing Parental Conflict programme.
Great, lovely, thanks Jude. Okay, Simran, I think we're ready to share now.
Perfect. Sorry, I was super eager earlier, but can you all see the
absolutely fine, not a problem at all.
Perfect. Can you all see that?
Yeah, that's great.
Okay.
And do you want to go on to the next slide, please, Simran?
Of course.
Thank you. Okay, so today during the session, we're going to be covering an introduction to the evidence guide structure. We will talk about an overview of the research around factors that can increase the risk of parental conflict among parents with mental health difficulties. We're going to look at what the evidence means for local planning, which is an important part of the guide. And Jude is going to talk about delivering specialist relationship support in the context of mental health. And back to you, Simran.
Thank you, Di. So to begin, I'll be providing a brief overview of the guide, which we published last year, November, including why we produced the guide and what the guide includes. So why did we decide to produce a guide which focuses specifically on supporting healthy relationships among parents with mental health difficulties? Well, firstly, evidence tells us that mental health difficulties are prevalent among parents, with depression and anxiety being the most common mental health problems experienced by women during pregnancy, and approximately 1 in every 10 fathers experiencing depression both pre- and postnatally. Secondly, evidence also suggests that parents' mental health difficulties can be worsened by the presence of parental conflict. So given these two findings, you'd think that we'd want to pay more attention to how parents with mental health difficulties experience parental conflict, but this isn't always the case in the UK, and so this guide is meant to really investigate that. So how is this guide achieving that? How is this guide helping us to better understand the experiences of parental conflict among parents with mental health difficulties and how to best support these families? Well, the guide is segmented into 5 different sections, each serving a different purpose related to your work. So the diagram here really outlines each of those sections and how they follow one another and build upon one another. So review. The first section provides an overview of the evidence of the factors that can increase the risk of parental conflict among parents with mental health difficulties and the impact of parental conflict on child outcomes. Plan builds upon this by providing guidance on how the evidence can be put into practice to inform your local strategy. Build provides a summary of evidence-based healthy relationship and parenting interventions to build your support pathway for parents with mental health difficulties. And then Measure gives a summary of measurement tools that can be used to measure parental conflict, parental stress, and co-parenting amongst this group in order to better understand if your support pathway is effective. And then finally, we have our Engage section, which provides recommendations on how to engage parents with mental health difficulties in relationship support services. And as I briefly mentioned before, this was formulated based on the perspectives of practitioners who have had the experience of working to recruit and retain this group of parents in relationship support services. So before we move on to reviewing the evidence included in the guide, we wanted to briefly collect your insights about where you think the opportunities are for partnership and who is doing the support work based on your experience with supporting parents with mental health difficulties. More specifically, we're interested in knowing who you think are the key partners in identifying and supporting parents with mental health difficulties. So your answers can be broad. It might be solicitors working with families or someone working in a nursery. So I ask that you put your answers in the word cloud that should pop up on your screen. So you can submit multiple answers, but once you just need to give a 2-second waiting period after you click the submit button. So I'll ask that you can go ahead and do that now.
So we've got some interesting words coming up here, Simran. We've got family support, community midwives, schools, health visiting, early help, all very, very relevant. Social workers, health practitioners, perinatal services.
Yeah, very interesting. It seems like early help, health, and school are a big one for many of us. Perfect. So I think, yeah, it's really interesting to see your reflections on this. And so since we have about 108 responses, I'll hand over to Steph to start the review of evidence. Sorry, Steph, I think you're muted.
I am. Well, I'm not now. Thanks, Simran. I'm going to talk to you about some of the research that we cover in the guide. As mentioned by Simran, in the review section of the evidence guide, we present an overview of the research evidence, covering in particular the evidence on the relationship between mental health and parental conflict, the factors increasing the risk of parental conflict among parents with mental health difficulties, and the impact on child outcomes. In this section of the webinar, we're going to present that evidence to you and highlight why it's important to consider when planning and evaluating local services, as well as how you could go about incorporating the research evidence into your local work, for example, by using the evidence to inform local planning or by identifying workforce training needs. This advice and information is based on the plan section of the evidence guide. For the review section of the guide, we undertook a rapid review of the research literature to gain an understanding of what is currently known in the area. The evidence used in this guide is a mix of primary research and reviews of research. There's very limited UK research on how parental conflict can affect outcomes for children of parents with mental health difficulties, and much of the research focuses only on anxiety and depression, two of the most common mental health problems. This overview includes the best available UK and international research evidence. The research evidence consistently shows that destructive parental conflict, meaning parental conflict that is frequent, intense, and poorly resolved, is associated with increased parental mental health problems, including depression, anxiety, and stress. Additionally, parental mental health problems are also consistently associated with increased parental conflict, with parenting stress, anxiety, depression, and postpartum depression all predicting increased parental conflict. We can therefore say that the relationship between parental conflict and parents' mental health is bidirectional, as illustrated in this diagram. If that's something that you've come across in your work, we'd really love to hear about it, so please feel free to put your comments into the chat. The bidirectional relationship between parental mental health and relationship quality is dynamic, and parental conflict might impact parental mental health and vice versa over the life course. A longitudinal study that followed women for 21 years from early pregnancy found that there was both a decline in marital quality over time and an increase in maternal depression. Longitudinal evidence also suggests that conflict characteristics can impact mothers' and fathers' depressive symptoms differently, and that conflict, which is characterized by fathers' hostility and defensiveness, predicts a higher rate of depressive symptoms in fathers, whereas conflict characterized by mothers' withdrawal and anxiety predicts a higher rate of depressive symptoms in mothers. So this means that mothers and fathers within the relationship may be impacted by different aspects of parental conflict, with fathers more likely to be negatively affected by their own expressions of anger, and mothers more likely to be negatively affected by feelings of withdrawal and anxiety stemming from conflict and marital dissatisfaction. The research suggests that maternal postpartum depression can impact fathers' parenting practices as well and levels of caregiving. One US study found that when new mothers show symptoms of depression, fathers engage in more caregiving activities such as feeding and nappy changing, but conversely, they don't engage in more play behaviours. Findings from that study also suggest that when a family experiences both poor maternal mental health and parental conflict, this can negatively impact on father play behaviours, with fathers both less engaged initially and slower to get more involved with play over time. So the authors propose that this could be a direct consequence of experiencing parental conflict, or alternatively, it could be the result of a situation in which mothers act as a gatekeeper and they start preventing fathers from engaging with their children in play contexts. Okay, so now I'm going to hand back to Di for the next few slides.
Okay, so there's a lot of information in those previous slides that Steph has just taken us through. And I just wonder what you think the implications of this evidence is and what this means for local planning. I think this evidence raises a lot of quite difficult questions for us. They're not necessarily questions that any of us particularly have the answer to at the moment. But I do think that it's a really important conversation to be having with colleagues, to really think about who these key players are that are having contact with parents, you know, there to support parents, and what we do to kind of understand what the experience is like for parents who may be facing mental health difficulties and what that's like trying to access services, and thinking about that kind of system of services and making it as accessible as possible. So there are a few kind of clear questions that we maybe need to be starting to think about, or starting to ask each other these sorts of questions. Can you just go on to the next slide, please, Simran? And these questions may feel quite difficult to answer, and I don't think they're necessarily relevant to everybody to ask these questions, but it's just a way of starting to think about what might be going on at a local level and where we can start impacting things and making a difference. So how effective is information sharing between adult mental health services and children's services? This is a conversation that we've been having for decades. It's not a new question to be asking, but in the context of this evidence, it's really important that we continue to ask this question and talk to each other about it. what local data is collected by adult mental health services or children's early help and social work services on the number of parents with mental health difficulties and parents with mental health difficulties who are experiencing relationship conflict. So we also know that there's very little direct local data about parents experiencing parental conflict. We're at the beginning of this journey very much. So you know, we need to start thinking about it, start taking some action, start planning, but it is early days. And the final one is what is the proportion of adult mental health practitioners who have received reducing parental conflict training? And again, there is no particular assumption in this question that any of those mental health practitioners have received training, but it is an interesting question for us to ask ourselves and to think about how we might go about changing that. So I'm going to hand back now to Simran.
Thanks, Di. So yes, continuing with the review of the research, particularly as it pertains to thinking about the role of family experiences. So research shows us that there are a range of family risk factors associated with parental mental health outcomes. So for example, financial difficulties, previous experiences of domestic violence, lack of support from the father figure in the family or the family network, father substance abuse, and having a sick baby or the death of a baby. And such factors have all been noted as putting parents at risk of postpartum depression. Similarly, family history of depression or a disturbed family environment, meaning maybe parental absence or separation from a biological parent before the age of 18, increases the risk of parents' anxiety disorders and major depressive disorders. So the diagram here on this slide shows us a few of the mentioned family-related risk factors, and I'm going to expand a bit upon the evidence related to these factors in the next slide. So in terms of financial stress, the evidence shows that financial stress, and this includes low family income, unemployment, or high housing costs, are associated with a decrease in relationship satisfaction amongst parents and an increase in both parental conflict and parental depressive symptoms. Similarly, international evidence suggests that parents with lower family income and lower education levels are more likely to use negative parenting practices, have destructive parental conflict, that is, as Steph mentioned earlier, conflict which is frequent, intense, and poorly resolved. However, parents with lower family income and lower education levels are also less likely to have, conversely, constructive marital conflict, and that's conflict that's characterized by open communication, demonstration of support, and effective resolution strategies. UK and international research evidence also shows that COVID-19 restrictions and pandemic-related stresses negatively impacted parental mental health and family relationships, with higher levels of parenting irritability and parental conflict. Evidence suggests that younger parents, families experiencing increased financial pressure or housing dissatisfaction, as well as parents with pre-existing physical and mental health conditions, experienced more strained family relationships. So within this slide, we're seeing how family experiences are shaping both mental health difficulties and parental conflict, and there's a lot of interaction going on between here, between those risk factors, So Di introduced us to this sort of application of the evidence to local planning and thinking about the relationships that we've highlighted and what they mean for local planning. So based on this evidence, you might consider some of the following questions for your local area. Are key partner agencies which support adults such as housing, homelessness, or welfare organizations aware of local support pathways for mental health and relationship conflict? What does the Joint Strategic Needs Assessment say about the prevalence of risk factors associated with poor parental mental health and poor parental relationships? And if you're not sure where to locate the Joint Strategic Needs Assessment, you might just Google JSNA and the name of your local area, and it might be easier to locate that way. And then finally, what local data is collected on the impact of poverty on family life and relationships? And you might pop into the chat some additional questions that you're thinking about asking based on the evidence that we've just presented on the role of family experiences. So moving on to another part of the research, which was speaking to the groups of families who may be at increased risk of experiencing mental health difficulties. So the research suggests that some groups may in fact be at increased risk of experiencing mental health difficulties. And given the relationship that we've established between parents' mental health and parental conflict, these families may also be at greater risk of experiencing destructive parental conflict. So UK data from 2014 shows that parents in some minority ethnic groups are more vulnerable to experiencing a mental health disorder. For example, even though psychotic disorders remain relatively uncommon among people from all ethnic groups, Black men are 10 times more likely than white men to experience a psychotic disorder. Relatedly, women from Black, mixed other, and Asian ethnic groups are more likely to experience a common mental health disorder, such as depression or anxiety, when compared with white women. When thinking about separated or separating parents, there is mixed research evidence on whether separation can increase the risk of mental health difficulties among parents across a range of outcomes, including anxiety, depression, and suicidal ideation and attempt. However, the evidence does suggest that couples who had depressive disorders before separation are actually more likely to experience future depressive episodes after separation, compared to both those who also separated but had no history of depression and those with a history of depression but did not separate. And then finally, as it pertains to parents of children with behaviors that challenge, some parents might experience poor mental health and consequently lower relationship quality. So international evidence particularly suggests that parents of children with some intellectual and developmental disabilities, so namely autism or cerebral palsy, exhibit higher levels of depression. Among parents of autistic children specifically, anxiety, depression, and lower well-being have been linked with lower quality relationships and lower relationship satisfaction among parents. So that was a mouthful. That's a lot to digest. But again, we want to always start to think about what this means for local planning. And so we might ask a range of questions. And these are just two examples of questions that are included in the guide. So the first being, how aware are key partner agencies of the links between child behavior problems, parental conflict, and the needs of particular vulnerable groups? Secondly, what data is available about the use of specialist relationship support services by parents and families with protected characteristics? So now we'd like to pause our review to have another word cloud reflection activity, which is connected to the engage section of the guide. So more specifically, we want to know what you think are the key characteristics of effective relationship support for parents with mental health difficulties. So again, you can put in multiple responses just once you submit the, once you click the submit button, just wait 2 seconds and then you'll be able to enter another response. So I'm seeing a variety of really valuable responses. Compassion is coming out as a key one, non-stigmatizing, honesty, mentalization, that's very interesting. A lot about being understanding. And this is something that really came out in our focus groups that we had about engaging parents with mental health difficulties. two aspects: how we shouldn't assume what a mental health difficulty means for each parent. So each parent that has anxiety, for example, might have a different experience, but then also that parents with mental health difficulties have fluctuating day-to-day needs. And so we might need to adapt support based on that and be attuned to that. So all these different adjectives about compassion, trust, empathy are really speaking to that. We also see cultural competency. That's really important when given what we spoke about with minority ethnic parents. Okay, perfect. Thank you all for your responses. I'll now hand over to Steph to continue with the review of the evidence.
Thanks so much, Simran, and thank you everyone for your responses. That was a really interesting word cloud. Back to the research, we were, of course, very keen to look at what the evidence says the impact of poor mental health and parental conflict is on child outcomes. So we found that poor parental mental health, specifically parent depressive, stress, and anxiety symptoms, is consistently associated with worse outcomes for children. These outcomes included both internalizing problems, which are behaviors that are directed inwards, such as emotional reactivity, anxiety, depression, and withdrawal, and externalizing problems, which are behaviors that are directed outwards, such as hostility, aggression, and conduct, behavior, and attention problems. Parental conflict might play a key role in this relationship between poor parental mental health and adverse child outcomes. Some evidence suggests that poor parental mental health can increase parental conflict or vice versa, which in turn negatively affects child outcomes, and other evidence also shows that the combined effect of parental mental health problems and parental conflict can worsen outcomes for children. There is, however, also a small body of evidence that suggests that parental conflict may not explain the relationship between poor parental mental health and some of the poor child outcomes. So the research also suggests that having parents with mental health difficulties in combination with a poor parental relationship can increase the risk of substance use later in children's lives, with one long-term study finding that low family cohesion in depressed parents resulted in a nearly four-fold increase in the risk of substance use disorder in their children 10 years later at an average age of 27. Interestingly, the child's perception of parental conflict may have a significant impact on child outcomes. So one study found that when young people aged between 9 and 15 with depressed parents perceived that their parents' conflict was intense, they were much more likely to exhibit internalizing problems. It's worth noting, however, that this relationship may also be the same for children with parents with good mental health. As well as the risk factors and the relationships between poor mental health and parental conflict, the research guide also covers the evidence for potential protective factors. The use of constructive conflict, which Simran mentioned earlier and is characterized by open communication, demonstrations of support and resolution strategies, is associated with lower depressive symptoms in fathers and mothers. Something that also highlights the differences in the associations between mental health and parental relationships between mothers and fathers. One study suggests that while if either parent in a couple is exhibiting this protective style of communication, this is associated with fewer depressive symptoms in fathers. For mothers, depressive symptoms are only lower when fathers demonstrate constructive conflict, but not when mothers alone use constructive conflict behaviours. Preliminary research during the COVID-19 pandemic suggested that family identification, which is measured by how well a person identifies with other members of their family, can help UK families to better cope financially and in turn have lower financial stress and better well-being. As Simran discussed earlier, financial stress is a risk factor for poorer parental mental health and increased parental conflict. And finally, in families where parental conflict is present, supportive parenting can protect against the negative effect that parental conflict can have on adolescent depressive symptoms. Thank you so much for your attention. I really hope you found the research overview useful. I'm now going to hand back to Di, who's going to introduce our next speaker.
Thanks very much, Steph. All really interesting. We're really lucky today to have with us Jude Gordon from Relate, who is really experienced in delivering specialist relationship support as part of the specialist interventions trial funded through the Department for Work and Pensions, but also through her continuing work with Relate in a number of different local areas. So thank you so much for joining us today, Jude, and over to you.
Thanks, Di. So yeah, I'm actually in London at the moment because I've been delivering training, and it struck me earlier when I was on the really busy tube commuter line, which is quite different to Newcastle where I am usually. That there's all these people milling around, and you're thinking, gosh, you know, 1 in 3 of these people have got mental health difficulties. We know that from the research. And then, you know, if you think about that in relation to parental mental health, I was thinking, gosh, there's like 20 million families in this country. So it's mad, really, that we don't give more thought to this, and it's so good that we are thinking about it and looking at it. I'm going to try. I could probably speak for a week about this stuff, so I'm going to try not to go over my time, and I'm trusting Di to shut me up if that happens. Can I have my first slide, please? Okay, so we know from the report and from the previous slides, which are really interesting about the links. So I really wanted to talk about, from a planning perspective, what the kind of considerations should be when you're thinking about staff recruitment, when you're thinking about relationship support pathways in your local areas. So I suppose where I got to, I was thinking back across the last sort of 3 or 4 years when we did deliver on the RPC programme, and such a huge amount of learning nationally, but certainly up in the Northeast, we were lucky enough to have a really broad area to work with across 10 local authorities. And a lot of the families we were working with, probably, what's the right way to say it, tick the boxes in terms of some of the things that have been talked about already today, in terms of financial stress, so quite high levels of deprivation, unemployment, and of course mental ill health and mental health difficulties. One of the things we were really keen to do on the programme in the Northeast, and I think a lot of other agencies followed suit nationally, was to engage both parents in specialist relationship support. So really to speak heteronormatively, you know, to involve dads in those conversations feels really, really important. And you know, mental health is obviously a huge spectrum, but we don't know what we don't know. So if we're not speaking to both parents, we can't really gauge where they're at emotionally. So it's really important, I think, when we're considering doing any work around co-parenting and reducing conflict and improving outcomes for children, that we involve both co-parents in that discussion where possible. So thinking about considerations then, timing. So we know that a lot of parents who are experiencing mental health difficulties are not going to be ready to talk about their relationships. One of our pieces of learning from the RPC programme was that often where parents were not engaging or hadn't been offered services yet around their individual mental health, we found that sometimes doing that first was helpful, particularly where a separation had happened, because there's a lot of emphasis on individual coping strategies within that kind of context. So thinking about the timing of relationship support is really important in the context of mental ill health. Also linking to that is the fact that we're never going to have a one-size-fits-all approach for parents. They come from all different walks of life. A lot of us on this call are parents or carers, and you know, we know that that journey is pretty individual. It would be wrong to say that one parent who experiences anxiety and or depression, you know, is experiencing the same kind of things as another parent who might have the same diagnoses. So we know that assessing and thinking with parents about their needs is really, really important, and that we need to do that individually before we embark on relationship work. Wraparound care, I've noted, again, this is huge, and an analogy I would probably offer that I've shamelessly stolen from a previous manager who's brilliant. He once said that, you know, the work we do with families is about this idea of Project 85, which is that it is 85% kind of persistence, warmth, compassion, relational practice with families where we are gaining trust and collaborating with them to own their story and think about what they need. And then 15% of that is the specialism and the stuff we know, the manual, the program we know that we need to deliver with those families. Thinking about wraparound care is super duper important. And you know, we were lucky enough in the Northeast to have some fantastic practitioners who really understood the importance of approaching parents with compassion, and recognizing that sometimes their experiences of services have not been hugely positive for whatever reason. And I suppose if you imagine, you know, that those parents are often kind of battling lots of different issues, including mental ill health, it's not surprising that it can take a few attempts to engage them sometimes. So I would say that persistence is something that really needs to be factored into a wraparound care approach for parents, and making sure that they have opportunities to check in either with the person providing the intervention or program, or a named person that they have a good relationship with that they can go to if they need to. I know I've talked about timing, but also time scales. I think one of the things that we felt a little bit confined by on the DWP pilot was having to try and kind of complete work with families in a certain time scale. Often that was possible, and you know, that worked well. But when we're thinking about mental ill health, we know that some days are easier than others for people, and that, you know, there's a huge kind of spectrum of mental health difficulties. And we worked with people who ranged from experiencing anxiety and depression, which Simran has pointed out are some of the most common issues, but also parents experiencing things like PTSD, psychosis, bipolar disorder. So really, you know, weighing up what the pace of an intervention needs to be for parents. And again, that just goes back to the not having one size fits all in your approach. And then just how the support is offered. We know that we've had to change practices quite a lot since the pandemic hit all of us. And those people with poor mental health were obviously heavily impacted. And, you know, that's been a pretty negative experience for a lot of people. One of the things that's come out of it is that we can use digital interventions, but we want to make sure that that feels right for the parent as well. And just going back again to the point in the guide, in the report, you know, often financial stress is a real thing for these families. So let's not assume that everybody has access to the internet, that everybody has access to a private space to have these conversations. We need to explore that and make sure that it is as accessible as possible, particularly where there is poverty. Can I have the next slide, please? So I just want to finish off really by making a few recommendations just from a practice perspective. So, you know, really involve parents where you can, and even better if they've got experience of conflict or experience of mental ill health and have managed to access some support or not. And you know, let's collaborate with people that use the services to make sure that whatever we mold, shape, plan really works down on the ground and is good quality. I think the best thing we did in the Northeast was recruiting somebody who had experience of our service, and she was really helpful in kind of shaping our journey. So it's really important that we take peer facilitation into account and that we think about it as a kind of collaborative and co-produced approach. Pause to take stock if we need to. So often we say that to parents, don't we? And we know that where emotional well-being is a concern, we do pause work. There's nothing to stop us doing that at a strategic level as well if something's not working, or if we're not quite sure which direction to go. And there's lots of partners out there who I know are really keen to kind of collaborate and think about that together, not least, I'm not going to say the mouthful again, but not least the agency here, and also, you know, lots of people in local authorities who are keen to help if you do need to pause and take stock. And just, you know, I know it's not an easy climate, but none of this stuff works unless we put the resources in. And, you know, that stuff about kind of having the space and having the right people doing the work, it does take resource. It needs to be good quality. And I think particularly in relation to parents who have those additional needs relating to mental health, we have to make sure that we have the resources to engage partner services to think about adult mental health and how we train up people and really raise awareness before we embark on the work. And finally, I've put evaluate your own ecosystem there, which is a bit of a phrase from Ben Collins, who was involved in the startup here in the Northeast. And the ecosystem is different wherever you go, isn't it? And even in the 10 local authorities that we worked with here in the Northeast, each area had kind of different communities. So really think about what it is that you have in your local area, you know, and we've mentioned sort of Black and minority ethnic communities. Think about what it is that you've got and how you want to achieve your goals in relation to sort of supporting communities and people individually with their mental health in the context of parental conflicts. It's really important. And I think that is everything from me, but I will be sticking around for questions.
Thanks so much, Jude. So much to think about there. I wasn't quite sure what the ecosystem thing was going to be about, actually. But yeah, everywhere is different, isn't it? And organizations are all different as well. But one of the things that it made me think about was us and ourselves and how we look after ourselves. And so if you're doing this work, and Jude might say something about this, you know, now or you know, when we do the questions, but this is quite challenging work. And you know, our own experience of having relationships can sometimes come up, and it can become something that feels quite difficult. And it's really important that, you know, you also have somebody to talk to yourself, and yeah, that you look after yourselves if you're doing this kind of work with parents. Okay, so we're bang on time, which is fantastic. Thank you so much, Jude. Fantastic presentation, and thank you for giving up the time to be here with us today. We're going to just go back to you guys now, just briefly, for a final activity before we take some questions. So this final activity is really just to think again about your local area and what this evidence and some of the things that Jude has said as well make you think about in terms of what is going on for you locally, in terms of your role. How could you use this evidence relating to the impact of poor mental health and parental conflict to influence your planning? But also just what else it makes you think of in terms of considerations in relation to your local offer. But also for some of you, it may be relevant to think about what data you have that would be useful in terms of how you prioritise what you do next. Like we said before, there isn't necessarily a lot of access to data, but there is some data. And it is a useful way and a useful process to look at that data, because sometimes we do have to prioritise what we do. So Bethan has put those questions in the chat, and it would be great if you could have a go at thinking about what your thoughts are. We're just going to read out some of the responses in the chat. Okay, so there's people having to leave. That's absolutely fine. Thank you so much for joining us today. No problem at all. And don't forget to have a look at the report. And just while I'm waiting for some answers to come in, just worth also thinking in the context of the work that's going on in local areas around family hubs. There's lots of needs assessment work taking place. And assessing local need is a really good starting place in terms of thinking about this data, a broad approach to data, thinking about those risk factors in relation to mental health and in relation to parental conflict. So there is a range of data there. That is something which is very much on the agenda for local areas. Some places are also doing a specific needs assessment in relation to parental conflict. So if you've got opportunities to be a part of that type of needs assessment, I would thoroughly recommend it. If you have got an opportunity to think about how you engage adult services in that type of needs assessment, that is also a really valuable thing to do. And also, it doesn't have to be data which looks like numbers or is on a spreadsheet. There is really valuable data that comes from the experience of practitioners and the experience of parents and families and children and young people, and all of that is data. So talk to colleagues who work in different sorts of services, think about all of those partner agencies that might be coming across those parents in a different kind of context. So I'm just looking at the chat now. Kate is saying, our team have just spoken this morning about how we include parental mental health as an aspect of some of our child mental health early help commissioned offers, which is absolutely brilliant. And a way of making sure that services that you're working closely with through a commissioning process are directed to have those conversations with parents. Really, really valuable way of thinking about this. And Karen, hello, Karen. Great that you're here with us today. It's ages since we've spoken, and I have tried to email you a couple of times. Lovely that you're here with us today. Karen says she's thinking about the link with perinatal mental health services, double challenges of dealing with the birth of a new baby and poor maternal mental health. Yeah, really, really important point, Karen. Suzanne is saying, hi, Suzanne. Suzanne is from Rutland. We've been looking at families that step up and down through children's services, and we noticed maternal mental health featured frequently. We've been looking at how we can support mothers better to help bring about changes to stop families yo-yoing in and out of services. Yeah, really, really important time in parents' lives, that early time, just before the birth of a baby and just after the birth of a baby. Kathy Robson is saying, I think having the input from adult services may help us in children's services realise how many adults they're working with who have mental health info and parental conflict, and how we can share that info to then be able to include that in the local offer. Also, more engagement from housing services, definitely, as the housing teams will meet many adults and children affected by conflict. And housing is such a huge issue generally for families these days that I think, yeah, housing professionals and homelessness professionals are really, really key people to engage. So
Can I
thinking
just
about,
chip in there, Di?
yes, of
The
course.
reason I kind of said about housing was my background is I was a housing officer, so I'm trained in housing law. And before I came over to children's services, our remit was anything safeguarding. We obviously used our, internal procedures, but then it was to walk away, leave it to children's services. So again, even if when, we're trying to engage housing officers to do early help assessments, based around the issues that they're seeing with parental conflict X, Y, and Z, they're still very reluctant to get involved because they see it as not, not their role, even though they are a partnership agency. So I think absolutely with the amount of information that a housing service holds about one single family and generational, I think, tapping in and getting them on board, is vital really in helping, promote parental conflict and work together. So I just wanted to add that in. Sorry, guys.
No, that's absolutely fine. Thanks, Kathy. Really relevant comments. Thank you. Lee Morgan is asking about support for this kind of work. I don't know whether, Bethan, you want to say something about the tools that are available on the EIF website and the local support offer at the moment. Are you there, Bethan?
I am, Di, yes. Yeah, I mean, I think it's we're obviously kind of coming to the end of some of our local development support for this year and thinking through kind of what will be helpful going forward. So it's really interesting to hear that there's a real appetite for support around some of this work. I think the needs assessment tool is really key in thinking through some of this. And Di, you mentioned earlier some of the links to the Family Hub projects and guidance and some of the work that's going on there, and how we might link in our reducing parental conflict needs assessment and what we know about the risk factors, some of which we've discussed today, and how that might link into that broader Family Hubs work as well, and the guidance related to that. So I will pop some of those links in the chat in a minute as well, in terms of some of those some of the guidance there. I had another thought on, I think in particular, the section of the guide which looks to kind of take some of what we know from the research evidence and think about what that might mean locally is a really kind of practical part of the guide to think through. So some of the questions that we've been posing today and having the broader discussion about form part of the guide, and there's some suggestions in there that can form, I think, a really helpful conversation locally to start thinking about how we might get a really clear understanding in terms of need and think about what that means for planning and services going forward. So I think that's a really helpful starting point in terms of thinking about application locally. But I'll also pop in the links to the needs assessment guidance, and also the guide on thinking about reducing parental conflict in the context of Family Hubs as well, because of course all of these pieces of work are interrelated and kind of work together. So I'll pop those in.
Okay, thanks, Bethan. I'm just going to go through a couple more of these comments before we move on, if that's all right. Peter is saying they're continuing to make contact with partners in health education, housing, and the SEND community to continue to inform them about the RPC programme and the connections between that and parents' mental health. That sounds brilliant. I know that there's tons of training going on across the country at the moment around parental conflict. And I think, just making that link during that training around parental mental health as well, if that is possible, that would be really positive. Jude is mentioning about probation and prisons, definitely really important. Karen. Karen is from SIPS and is saying that they will be completing training with mental health staff and will be involving them in completion of the RPC planning tool. That's fantastic. Can I just ask you, Karen, where you're from? I can't see that.
I'm from Wigan, Healthy Relationship Coordinator at Wigan Council.
Oh, wow. Well done, Wigan. That's fantastic. Really pleased to hear about that. It'd be really interesting to hear how it goes.
Yeah, well, they contacted me. I sent out invites for training and they asked me to do a bespoke one for them. So what I'll do is I'll include some of the information from these slides and then they're going to be on like the planning board for the tool when we complete that as well. Excellent. That's great. Great that you're getting some time from them, which is really helpful, isn't it? Renee is saying about introducing more mental health sessions into the school curriculum. And yes, definitely, I think there's some really interesting work going on in schools around healthy relationships with children and young people. And there's some great resources out there. So in terms of kind of changing the culture of how relationships take place, it's so important that we do that preventative work with young people. So question from Catherine here, really good question. Are people confident that RPC working is being pursued through Family Hub implementation? Don't feel equipped to answer that myself. I think it's, well, I think I would probably say it's variable. And I think it's just still really early days. I really hope so, because it's such a fantastic opportunity. And like you say, Catherine, it is specified in the documentation and all the guidance around Family Hubs that it needs to be a core part of that offer. I think at the moment it feels like there's an awful lot for areas that they have to do around Family Hubs. But I think it's really, really important. Yes, really important. Completely agree with all your comments, Catherine. Thank you. Shara is saying, I work for a domestic abuse perpetrator service and I've seen a massive need for behaviour change work to increase understanding of what a healthy and unhealthy relationship looks like, as well as tools around general communication. Absolutely, yeah, it's so important. Multi-agency working alongside this is so important when it comes to mental health. We are called the Change Project. Seeing more services like ours is really important, in my opinion. Really helpful. Thank you, Shara. Really useful thing to point out. Yeah, it's really important that we have those preventative services in place. Okay, so I'm just going to move on to our final couple of slides, if that's okay. So this slide really is just kind of illustrates how much we've got to think about at the moment. And like I said before, this isn't necessarily relevant to everybody on the call, but it just is a prompt really to think about what sorts of areas we can be thinking about. And I'm just going to go straight on to the final slide so that we've got time for questions. So these are just some examples of strategic and data collection questions, and I'm just going to read these out very quickly. And when I finished reading these out, we've still got 15 minutes. What I'd like us to do is for people to put their hand up or use the chat, and particularly to think about if anybody's got any questions for Jude or specifically for the researchers that were involved in this guide. So these questions are just examples. Our key partner agencies supporting children and families aware of the risks and taking action to support children around reducing parental conflict. What data is being collected by mental health in schools practitioners, which might further inform a response to reducing parental conflict in schools? Really good question. And what data do or should universal services for children collect and inform how they support children of parents with mental health difficulties? And what mechanisms are in place to record and act on the views and experiences of children and young people who have experienced parental conflict or who have parents with mental health difficulties? Okay, so those are just some thoughts about the sorts of things that you might be thinking about to talk about locally. There's no shortage of questions to ask in my experience in this area, and no shortage of partners as well to engage. So that is the end of our slides. So if you could perhaps stop sharing, Simran, and we could take some questions direct from participants. So if you don't want to put your hand up, that's fine. I will continue to have a look at the chat. We've got a comment here from Deborah. Outcomes that we see consistently in education are attachment difficulties, parent to child, child to parent, and persistent absence. However, parents with mental health difficulties do not always consent to support available. And again, that is really common, I think, with early help services. It is a really challenging issue, consent. I think it kind of begs the question, what is it that we're doing to make those services as accessible as we possibly can? What more can we do to reduce the level of fear perhaps that parents have of services, or just, you know, underlying anxieties? And I think there's some amazing things. There was somebody, I can't remember who it was now, but there was somebody from a school that was telling me that they have information about specialist relationship support on their school gates. So I think that there's something about reducing stigma, isn't there, of accessing these sorts of services and just making it a conversation that we are having in the schoolyard, whether that's with, you know, somebody who works in the school or with a friend that we happen to bump into when we're dropping our children off or our grandchildren off. So it is difficult. I completely realise that it is difficult. Are there any questions? I'm just going to particularly ask if there's any questions for Jude.
Just have one pop into the chat, Di. So from Catherine, any thoughts about the potential to help engage families with relationship support through trusted workers in the voluntary sector? So thinking about things like debt support and community stay and play.
Do you want me to answer that, Di?
I think that would be great, because I'm thinking about, you know, whether you have had referrals, for instance, from a whole range of different sectors.
Yeah, I think there's a lot of work to do still. That would be my instinct. And I know a conversation that you and I had recently, Di, was just highlighting that there's a couple of points I'd make here, still very much at the start of the journey. And you know, it's difficult work, it's quite hard work, and it involves a lot of collaboration. But I think in terms of Catherine's question, the potential to help engage families with relationship support through trusted workers is absolutely where we want to be. And it goes back to that kind of wraparound care that I was talking about earlier. You know, there's nothing better for families, in my view, than having a team around them that they trust, that they, you know, enjoy talking to, and that they feel safe with. And if those agencies can help with that, then I'd absolutely support that as an approach.
Mm-hmm. Okay, are there any other questions at all? I want to read out Peter's comment, Bethan.
Yeah, so just a reflection from Peter in terms of an observation that we're part of a bigger picture in terms of normalising conversations with adults, but also with children and young people, about strong relationships and kind of effective communication as well. So a reflection, I think, on some of the discussions we've had today, and in particular about kind of some of that multi-agency and partnership approach, and this being part of a much broader kind of partnership approach. And there's, I think, still some more thoughts going into the chat. Really, really interesting reflections on the earlier discussions about kind of how this has made us reflect on kind of local support offer and the approaches to that, and also some of the kind of key information and data locally that might help to inform some of our response. So still some thoughts going in, which I think is really, really helpful from that perspective.
Yeah, so we've got Samantha talking about engaging with CAB and community and private sector early years to attend their road shows.
And just some more reflections, I think, from Kathy Dye on some of the opportunities within family hubs in terms of kind of bringing those services together, and also I think a reflection on that earlier discussion or earlier question on community groups and voluntary sector, and kind of that, I suppose, the developing of the relationship between services to help some of those referral pathways and some of that support for families as well. Jude.
I was just going to make the observation that I think what sometimes happens when we're discussing children's outcomes is that we focus quite heavily on situations where there's a new baby and perinatal services, particularly in relation to mental health. And talking to someone, I suppose, with a bit of a background in supporting young people and the kind of risk-taking behaviours that young people often engage in, we know that parental conflict is a push factor for children and young people, and there was some really interesting stats talked about earlier in terms of the sense that 9 to 15-year-olds make of their parents' relationships. I just wanted to say, please don't forget about adolescence in your offer, and make sure that, you know, young people, particularly young people with additional needs as well, are catered for, and that it's recognised that actually parenting teenagers is really hard, and if your relationship is in distress as well, then it's double hard, and in the context of adult mental health as well.
Yeah, really important point, Jude. Thank you. Renee's also mentioning how important it is to link in with multi-faith groups in the community. I don't know if there's anybody who has any experience of that on the call, but yeah, I think that's a really fantastic opportunity as well to just understand the different cultural context in which relationships take place. And just going back to what Jude was saying before, you know, there isn't one size fits all at all. Okay, are there any other questions that people would like to raise today? Okay, well, that's great. I'm very pleased that we're finishing in good time. Thank you so much, everybody, for attending. It's been really interesting. As